Well, most of us know someone who's battled Alzheimer's disease, but now a new treatment is on the market, a first of its kind IV drug to slow the progression.
They will have the opportunity and potential to access something that could change their life.
The drug aducanumab is the first new treatment for Alzheimer's disease in nearly 2 decades. It aims to slow the progression of the disease by removing sticky deposits of a protein called amyloid beta that happens in the brains from Alzheimer's patients. And as 13 News reporter Richard Bodie reports, doctors say this is a gateway for treating brain diseases, and advocates are thrilled about the hope the drug offers.
We only have a finite amount of time, but for Alzheimer's patients, time is stolen. This new drug could give families time back.
To make plans in the future, to spend time with family, to hold on to their memories.
It works by targeting protein buildup.
It reduces the rate of plaque formation in the brain of patients with early Alzheimer's disease.
Aducanumab is an IV medication given once a month, treating the disease, not the symptoms, the first to do so. An option advocates say they've been waiting for a long time.
I think it takes a real weight off of their shoulders to know that, there's something out there that might keep them at the stage that they're at for a little bit longer.
It's the first drug to actually do something about what's going on biologically in the brain.
And while it's not a cure, Dr. Bartlett says it opens doors to study the brain and treat other illnesses.
The bigger story in this is the explosion of biotechnology and treating so many other disorders that we never dreamed.
Now, there have been questions about the drug's effectiveness. Bartlett says that while the data showed plaque reduction, it didn't necessarily stop deterioration. But he says because the plaque reduction is so great, the FDA says the drug will likely be effective over time.
It appears that from the data that the patients tolerated the medication quite well.
But there is one potential barrier.
Will the Blue Crosses and the other commercial insurers pay for this?
Bartlett says an entire series of infusions could cost up to $50,000, but he thinks insurers will be on board.
I think they will.
A once hopeless situation, the drug gives the most precious of resources to patients and caregivers: more time. For your 13 Weather Authority, Richard Bodie, 13 News.
And back in November, an FDA advisory panel of outside experts recommended against approving aducanumab, saying there wasn't enough evidence to show that it worked. Today, that agency acknowledged the benefits outweigh the risks of the therapy.